So this one hits home because I am a medical student, and recently this past summer, two universities announced that they will be having free tuition for all of their medical students. One, University of Houston's New College of Medicine, which is a smaller school, a smaller number of students, and then also NYU Langone School of Medicine is offering free tuition to all current and future students regardless of need or merit. And so while NYU is one of the top 10 schools in the country, there has not been any other schools at this caliber that have offered free tuition. Now, in 2017, Columbia University, Vagelos Physicians and Surgeons, they did promise free tuition to anyone who met the needs who qualified for financial aid, which did eliminate a lot of the burden for students that could not pay for it or didn't have the financial resources to pay for medical school themselves. One of the things that we've seen trending over the past several years is that medical school prices have been increasing, and students are growing in the amount of debt that they're taking out to not only pay for medical education, but also pay for rent, rotations, licensing exams, board certification exams, and these are things that are drastically affecting and increasing the debt that physicians graduate with. They said, AAMC just said that 75% of all graduating physicians owe money, and that was back in 2017, and about 25% of all graduating physicians owe between $200,000 and $300,000, with the average amount of median debt being $192,000 for total graduates. And so I want to highlight a Medscape interview that recently took place, and that was between Dean Grossman from NYU and also Tim Rice, who is the Deputy Director of Health Policy at the Manhattan Institute, where they flesh out all the pros and cons of having free tuition for medical students, something that I think maybe some other institutions will start to look at and think, how can we create a fund or an endowment fund to create free tuition for all of our medical students in perpetuity? Yes, medical education is high. People have looked at trying to reduce it, but by eliminating the burden through tuitions, through scholarships, through endowment funds, they may be able to cover those costs to allow the university to still have the profiting capital that it needs to provide the resources to graduate these students on time with the highest training possible, but also to reduce the debt on students. So there's two reasons why tuition reduction or free tuition matters. And the two major points that have been pointed out is that there is an increase in number of students pursuing primary care specialties who don't graduate with debt. Now, while these numbers are shaky and it hasn't been analyzed very well, that is something that a lot of lawmakers and people in medical education are pointing out, that by reducing the debt burden, more physicians may be willing to go into primary care. And this is actually something that you need to consider, because the demand for primary care physicians has been increasing slowly over the years, but the interest from graduating physicians for primary care specialties has actually been dwindling. And the second major reason in consideration of why free tuition is beneficial is that having free tuition increases the scope of applicants to medical school from underrepresented minority physicians or students who may otherwise be deterred from the amount of cost and debt they would have to go and procure to go into medical education. So this is something that I think is really crucial to students. I think physicians feel this at heart, but there is kind of a disconnect we've seen between physicians and medical students on their opinion about free tuition. There was a Medscape poll that we recently did where 89% of all medical students are in favor of free tuition. I think we know exactly what it feels like to have to pay this amount of money and go into debt for it, whereas only 71% of physicians support free tuition. So there is a discrepancy there, about 18%, which is difference. Now, the more interesting thing that I want to point out is that you may be asking, are medical students that graduate with zero debt, are they at an unfair advantage? And so only 21% of medical students thought that those graduating with free tuition versus those not were at an unfair advantage. So it's only 21% of medical students that feel like this is an unfair advantage, Whereas physicians, doctors that have already gotten out of medical school, who already have the debt built up from ones who didn't have free tuition or didn't have the means to pay for it from family or from other donors, 45% of doctors thought that this is an unfair advantage. And that's a big jump. That's 2 times more physicians think that there is an unfair advantage here. Now, you may be asking, well, does this actually change specialties? And what are medical students and doctors saying about the specialty that people go into if they come out of with free tuition? Well, 21% of doctors think that this would actually change how they viewed their specialty. So the majority of doctors, it seems like, would still have picked their same specialty looking back. But medical students now, 49% of them actually says that tuition rates and the debt that they accrue actually is going to affect their decision of what specialty they're going to go into. So there is some discrepancy between what medical students and physicians think. I think it's important to point it out. But it's also important to point out that there's a big difference between public universities, private institution, in-state versus out-of-state tuition, and also between allopathic and osteopathic medical school prices. This is something that I think is very important. On average, most public schools only have an annual tuition of about $37,000, not counting room and board and everything else that has added on. But most private institutions is all the way at $59,000 a year. When you look at osteopathic schools, yes, their amount of tuition tends to be slightly lower on average. There are some schools that have over $60K tuition every single year, but the majority of the osteopathic physicians are actually going into primary care specialties, which do not have as lucrative payouts after. And so I think this is something to consider. If this past year, even just this past week, when there was the DO match for osteopathic medical students, 56% of them went into primary care. And these are students that don't have free tuition, that are graduating with high amounts of debt, going into primary care, and they could be paying off their tuition debt up until their 50s and their 60s, which is data that was recently discussed on that interview that I discussed that was on Medscape between Dr. Grossman and Tim Rice. So I want to thank you guys for this episode. If you want all of the links for the medical school free tuition, make sure you click the links below.